Thank you all for being here today. We are obviously here at the UPS location in Austin, Texas for what is going to be an extraordinary day as Texas continues to take steps to conquer COVID in our state. I particularly want to thank our host for the day, Nick Dandra, for his connection and his leadership with UPS, working collaboratively with the state of Texas to make sure that we are able to distribute the COVID vaccine across the entire state of Texas. Operation Warp Speed is a monumental medical miracle that is on a daily basis now saving lives and beginning to restore normalcy in our community. And I want to thank UPS for the role that it plays as the primary deliverer of this transformational medicine that will help Texas get back to normal as quickly as possible. Texas has been a national leader in being able to structure a system to achieve this fast, effective, swift distribution of the COVID-19 vaccine. We have more than 7,000 providers that are lined up, prepared to distribute this once they receive the medicine from UPS. Right now, the lead recipients of the COVID-19 vaccine are our doctors and nurses on the front line. I got to tell you, it was moving. It was heartwarming to see the doctors and nurses who received this vaccine just yesterday or the day before literally break out in tears as they knew that they were receiving medication that was going to protect their lives. Everybody owes a debt of gratitude to these doctors and nurses who have been on the front line for months now. The warriors at the tip of the spear, working around the clock, sacrificing their own lives for the health and safety of their fellow Texans. We cannot thank them enough for risking their lives to care for others. And that is exactly why they are in the front of the line, so that they will be able to be vaccinated, so that they will be able to continue to serve on the front lines, helping others who are coming in with COVID-19. In addition to that, we are beginning the process of making sure that we are able to get the vaccines to our most vulnerable residents in Texas, and that includes especially those who are in nursing homes, who are seniors, especially those who may have comorbidities or other types of healthcare issues. As General Perna put it, when I was in Washington, D.C. last week for the White House Operation Warp Speed Summit, he said that we have one goal, and that is to save lives. And Texas has a distribution system in place to make sure that we're stepping up and doing everything we can to save lives. And that's exactly what you will begin to see. Let me explain a little bit about how this process works. This is a very carefully calibrated process about how we go about distributing the vaccines. Each week, Texas, as well as the other states, gets a weekly allocation about the number of COVID vaccines the state will be receiving for that week. During the course of that following week, there will be several days during which UPS will be making the initial delivery. Right now, because of the cold chain process that's involved in the Pfizer vaccine, those deliveries are going to about 110 hospitals, from which there can be additional distributions. And then next week, it is fully expected that Texas and every other state in the United States will be receiving not only the Pfizer vaccine, but also the Moderna vaccine. And so right now the weekly allocations are along these numbers. Before coming out here today, before today, we had already delivered about 95,000 doses of the COVID-19 vaccine. Today, an additional 129,000 doses will be delivered across the state of Texas. So that means for this week, we have about 224,000 doses of vaccines that will be delivered. This is going to increase, as I pointed out earlier, next week when we have not just the Pfizer vaccine, but also the Moderna vaccine. And that will allow us to be well over 1 million people who will be vaccinated just in the state of Texas alone just this month. And those numbers will continue to increase as the production continues to increase and as both the Pfizer and the Moderna vaccines come online. Next month, and actually maybe even beginning next week and later on this month, we will be delivering to not just hospitals, but healthcare centers, clinics, pharmacies, freestanding emergency rooms, urgent care centers, long-term healthcare facilities will be receiving these vaccines later on this month, as well as local health departments, state hospitals, and state-supported living centers. We always want to make clear that vaccines are transformational, but there are some people who do not want them. And so vaccines in the state of Texas are voluntary, never required, but we will have a keen focus on who will be first in line for these vaccines. The last thing I'll mention before I pass things off to Dr. Hellerstedt is that in addition to these vaccines, there is another very important medical treatment that is available that we are strongly urging the holders of these vaccines to be more proactive in providing them to patients who need it. They're called antibody therapeutic drugs. One is made by Regeneron, another is made by Eli Lilly. There was great discussion when I was at the White House earlier this week about the urgency to make sure that these antibody therapeutic drugs are provided to people. They are sitting on shelves in hospitals and other locations around the state, and that's not being used for the reason which is it is intended. These are life-saving antibody therapeutic drugs that can be put into people who already have COVID-19 and help them recover and help keep them out of hospitals. One thing that we can and must do as we speak right now, and that is to use every tool that we have to reduce hospitalizations in the state. That requires every recipient and holder of these antibody therapeutic drugs to make sure they get them off the shelf into the people who need them, so these people are going to be able to recover and not have to stay in the hospital, and so that the hospitals will be reduced in the capacity that they're dealing with right now. That said, there have been leaders in the Texas strategy to make sure that we have what appears to be the most effective and robust vaccine distribution system in the United States. And that is Dr. Hellerstedt, the Commissioner of the State Department of Health Services, as well as Nim Kidd, the Chief of the Texas Division of Emergency Management. At this time, I will pass it off to Dr. Hellerstedt.
Thank you, Governor Abbott. This is really a great day. This is the day we're seeing the culmination of the science that has been going on ever since the COVID-19 pandemic began. And we're seeing what the power of science can do, the power of our genius, of the scientists and people who are developing these vaccines. These vaccines are proven safe and effective. I think that is something people should never forget. Nothing about the ability to look at the safety and effectiveness of this vaccine was shortcut. Instead, what happened was the government said, if you've got a good candidate vaccine, begin manufacturing it in mass so that we could have the kind of day that we're having today, where the vaccine can go out and begin to be administered to thousands of people, and eventually, as the governor said, before the end of the month, a million Texans or more. This is the ray of hope at the end of the tunnel, but we're not done yet. This is a marathon. We're at that point in the marathon, I think, where we're all about to just hit that wall, as they say, and we need an extra boost of confidence and optimism that'll get us across the finish line. And that is the vaccine, in my opinion, as well as the monoclonal antibody therapies that the governor talked about. Both of these are extremely important modalities, and if they can be used to their maximum effectiveness, we will begin to see some amazing trends, some reversals of the trends of COVID disease and hospitalization in our communities. So we should all be very hopeful, but we should also be very patient and understand that eventually we don't need just 1 million vaccinations, we need hundreds of millions of vaccinations, and that's going to occur over the coming weeks and months. Thank you, Governor.
Thank you, Doctor. Now the Chief of the Texas Division of Emergency Management, Nim Kidd.
Thank you, Governor, and thank all of you for standing out here in the cold. When we started this, we had one tool in our toolbox, and that tool was masks, hand washing, social distancing. As the governor mentioned, the therapeutics that have been out on the streets for weeks now are another tool in the toolbox. We really need to make sure that tool is being utilized. And now with the excitement of the vaccine and our great partners at UPS to help get this delivered, this is a great tool for us right now. Our team will continue to focus on personal protective equipment, making sure all healthcare workers have what they need. We'll continue to focus on testing. There are over 2,500 sites across Texas today to go get a COVID-19 test, and we will continue to push hard to get this vaccine not just to the hospitals or the doctor's offices or to the pharmacies, but into the arms of Texans.
Thank you. So last week I had the opportunity to participate in a summit that provided information to the public across the United States about how the system works. And it's amazing when you look at Operation Warp Speed because it is a true American collaboration across all sectors. You have the best scientists and doctors who have been researching and then producing this vaccine. You have pharmaceutical companies who are able to manufacture it and put it into a position for it to be distributed. You have government operations, whether it be federal, state, or local, to make sure that distribution systems will be set up. But in order to make it work, we had to have the platform available to us so that we could very rapidly distribute the medicine to the locations where it needed to go to. And that's where UPS comes into play. We're so grateful that we have systems like what UPS is able to deliver. And we're thankful for Nick Dandra for being here and for the leadership role that he and UPS play. Nick.
Yeah, well, thank you, Governor. And I will just say on behalf of the 30,000 UPS employees here in Texas and the 500,000 we have across the world, we are honored and humbled to be a part of this project. And believe it or not, this isn't the beginning of us with the pandemic. We started moving PPE and equipment and testing kits for the state back in March. And so this is just another step, but what we hope will be the final chapter in this pandemic. So I will say I can't thank the leadership enough of Governor Abbott and Chief Kidd. They've worked with us every step of the way since March to make sure that we could operate safely. And I know in terms of what you see to the left of me here, they're working every day to make sure that we are able to deliver that volume freely if there are any issues that arise. So I certainly want to thank both of you for your support for that. And let me just close out by saying this. As the holiday season approaches, this box right behind us here is the most important gift that we can give somebody this Christmas season. And I'm glad to be a part of this. UPS is, and thank you very much for your leadership, Governor.
Sure. So we'll take a few questions. However, why don't you add a little bit more about what is in that box?
Sure. I can tell you right now there is up to 5,000 doses in that box to the left of us, as well as dry ice that is on the top and the bottom. That dry ice has to be replenished every so often. So once the vaccines arrive at a location, we actually have to refill the dry ice every so often. And so that box is it's a heavy box, but as I said, each of those boxes can contain up to 5,000 doses, and there are multiple, as the governor described, of those being delivered today. And it sure is a great day for the state of Texas.
Great.
Governor, there's been calls for teachers to be moved up in the queue, also prisoners to be moved up in this queue to get the vaccine. What's your opinion on that? Should they be moved up?
So listen, teachers, for example, play such a pivotal role in our society, and I consider teachers to be frontline workers. And part of restoring normalcy in our state is to make sure that we get our kids back in schools in a learning environment that is best for them. And part of achieving that goal is to make sure that we will have teachers in a safe, secure situation, vaccinated, able to be in a classroom teaching without fear of getting COVID-19. And so I urge and hope that teachers will be near the front of the line in receiving this vaccine.
Yeah. Governor Abbott, in June you said reopening bars was one of your biggest regrets, yet here we are with a lot of bars back open. Others are, say they're restaurants, but they're open late. You know, we're at a point where 252 people died yesterday, 24,000 people have died overall. The vaccines, everyone is very excited about them. but others are concerned that we're not going to be getting them in the general public for 3, 4, 5 months. So are you considering more restrictions to stop people from dying and getting sick here in Texas?
So first, I disagree with your timetable about when people will be receiving these vaccines. Remember, there's really one element that necessitated any type of rollback whatsoever, and that is overwhelming hospitalizations that would make it impossible to care for people. Remember that 99% of the people who get COVID face minimal challenges whatsoever. The only time we run into challenges is when we start running out of hospital beds. What this vaccine will be able to achieve is, in the short run, be able to treat the types of patients who would be most likely to need a hospital bed and most likely to lose their lives. And so I think that you will see very significant results coming from that. Second, one thing that has been clearly apparent, and that is there's been no governmental leader anywhere who's been able to figure out how COVID works. One thing that we've seen, for example, is we've seen these massive shutdowns of businesses in California that have led to only a greater spike in the spread of COVID-19. California has some of the toughest shutdowns that we have in the United States of America, and yet they are skyrocketing and leading the United States in the number of cases. Oftentimes, when you do have shutdowns, you have people going to homes, and one thing that we've learned now is that one of the places where COVID-19 is spreading the fastest and causing the greatest problems is in the home setting. So the fact of the matter is, it is time to put behind us shutdowns. No more shutdowns. We need to focus on opening up businesses. One thing that we know today is that every adult in the state of Texas knows exactly what COVID-19 is. They know how to protect themselves from it. They know how to prevent spreading it. Every adult in Texas has the responsibility to follow the safe practices as we continue to work our way out of this. If they do that, we can contain COVID-19 while we continue the process of vaccinating our fellow Texans and continue to open up. People's lives have been crushed, and their pocketbooks and their ability to pay the rent and put food on the table has been harmed because of the shutdowns. And so, no, we will not have any more shutdowns in Texas. I do think the Capitol should be reopened, and the Capitol will be reopened.
Great, thanks guys. The governor has to go, but...
Agreed with the timeline. Are we going to see vaccines before March here in Texas for the general public?
I believe we will. Yeah. Here's the deal. You're using this generalistic term, the public. The public includes seniors in nursing homes. The public includes people over the age of 80. The public includes people over the age of 70. The public includes people over the age of 60. And so, yes, there's going to be a lot of people. The public includes school teachers and people like that. Yes, there will be widespread distribution, because remember this, both Pfizer and Moderna will be increasing the volume of production that they have. But also, we do expect that before we get to March, there will be additional vaccine providers, including Johnson & Johnson, which is a one shot. Is Johnson & Johnson one or two shots? I can't remember.
It's
two shot. So there's Johnson & Johnson. There's another one, and maybe AstraZeneca. That's the one shot. There will be multiple vaccines available to us by the time we get to March, and we will be providing far more doses of vaccines than what we currently have. I do have to be giving formal remarks in 15 minutes, so I'm going to have to go. These people right here will have plenty of answers to all of your questions. Thank you all very much.
Thank you, Governor.
Thank you, Governor.
Oh, so I have not received the vaccine. I will take the vaccine, and I will take it at the appropriate time. I wanted to make sure that the healthcare workers who have put their lives on the line on the front end will be the first to receive it. But yes, I will be receiving the vaccine at the appropriate time. Oh. Thank you all.
In regards to UPS, how many drivers today are out delivering those boxes from here?
From this facility, well, there's various places, so there's 7, but 7 drivers out of this particular facility.
Is that so that's the Austin area, or is there another facility here?
Well, there's other facilities in Austin, but out of this particular facility, there are 7.
So how many here in the Austin area drivers are patrolling that?
Excuse, say that. Repeat that for me one
How
more
many
time.
drivers Austin-wide?
10.
grab that one, Doc.
Sure. The specific selection, if you will, of healthcare workers, and it's not, if you will, every healthcare worker. It's really aimed at, we're giving it to hospitals, because in hospitals they're taking care of COVID-19 patients. And that means that not just doctors and nurses, but everyone in that hospital system who's in an area where their COVID patients are being cared for is being exposed to COVID 100% of the time they're on the job. And so that is a very unique situation. There's really no one else other than those healthcare workers who are experiencing that constant level of exposure in carrying out their duties. In addition to that, as the governor said, our main focus all along has been to slow the spread of COVID in our communities sufficiently that we never ran out of beds in the hospital for people who got sick. We've managed to do that. We should actually be very proud of the response that we've had. It's been rough. There's been suffering. There's been loss of life. But nonetheless, we've still gotten to this point where we have an incredible ray of hope ahead of us. But we still want to preserve those people. Imagine now, as the governor pointed out, these people can have an extra layer of armor to help protect them. So even though they're taking those other precautions, now they're going to have an extra layer of protection and be able to stay on the job and be able to provide that service for people who need it. And don't forget, they're not just there taking care of COVID patients. They're taking care of people who need to be in the hospital for whatever reason. Automobile crashes still continue, heart attacks, strokes, appendicitis, and delivering babies all have to keep going on. And that's why we want to preserve the integrity of that hospital-based workforce.
Doctor, will your agency bump the teachers up in the queue now that the governor says he believes they're frontline workers? Can they be bumped up?
We are looking at the next allocations of vaccine and making some very nuanced, if you will, decisions. I'm relying on and listening to, taking under advisement the recommendations of our expert vaccine allocation panel. It's a 17-member panel. It really, truly is an expert panel. They have a very solid sense, if you will, of bioethics and how to manage the bioethics that we all believe in to make that happen in terms of the next phase of distribution of the vaccine. So that's we'll look at every aspect of the next phase and make our decisions based on that.
For those who fall outside that very first tier, when will the vaccine, you think, be available to them, and how and when will they get that information?
We will provide that information as time goes on. Again, as the governor pointed out, Operation Warp Speed, it's not done. I can guarantee you that there's still an emphasis on increasing our capacity to have these vaccines as soon as possible and in as great a quantity as possible. So I wouldn't want to give a date because I don't think we have that date. I can tell you that they're pouring every resource into providing those massive quantities of vaccine that we need going forward. And so we need to be patient. It'll still be weeks, perhaps months, before it is absolutely available to anyone who chooses to have it. And also, in the meantime, we need to continue the kinds of things that have gotten us this successful so far. So those, what we call non-pharmaceutical interventions, the physical social distancing, the wearing masks, the hygiene, the personal responsibility, and I think that really deserves emphasis. We've achieved the success that we have because enough people were willing to take on the personal responsibility to carry out those infection prevention measures that we've recommended.
Hospitalizations are at their highest point since July. Are you concerned about that? It sounds like you think that therapies and this vaccine are what we need to do right now. Is there more that needs to be done?
Well, again, that's a great question. I'm not sure I heard the very beginning of it. You're talking about
Hospitalizations for coronavirus patients are at their highest point since July.
That's correct. And so we had a resurgence. That resurgence is in other parts of the country as well. It should be of great concern to us. And so I'm glad you asked the question the way you did. The vaccine and the antibodies are a ray of hope. They are not yet the answer. They will be the answer as time goes on. What is still the answer is exactly what you're wearing on your face and exactly what we're doing here in terms of distancing ourselves and practicing those infection prevention, those non-pharmaceutical interventions that have gotten us success so far.
Would you agree would you agree then with the governor's March timeline that he laid out for the general public? He said he didn't want to give an exact date. Do you think that timeline that he laid out is reasonable?
I think it's within the span of what we think is reasonable and what can occur. This is, if you will, an unprecedented effort that we've made as a nation, as a world, really, to develop safe and effective vaccines in such a short period of time. And believe me, they are proven safe and effective. They are 94 and 95% effective. And in the terms of vaccines, that is absolute gold. That is platinum standard. We are very, very blessed to have that level of protection right around the corner. But we're going to have to be patient. We're going to have to understand the need to persist in doing the things that have been successful so far, while we enjoy, again, that added benefit of the effect of the vaccines and the monoclonal antibodies.
Great, thank you all.